Right. So, hello everybody, and welcome to this Friday night live session where I want to answer some questions people have asked. So we'll go through a few of the questions people have sent me, and as this progresses and anybody else has questions, I'll answer that as well. So the first thing I want to just say is, I just hope people are okay with being locked down with COVID. Please be careful. Keep your face masks on. Keep social distancing, and just look after yourselves. It's short-term pain for long-term gain. So I really want to ask you to look after yourselves, look after your loved ones. So we're going to go ahead. As I speak, please feel free to ask me any questions you may have. But I'm going to kick it off with the first one. So the first question is, what is a facial plastic surgeon? So I'm a facial plastic surgeon, and how I ended up becoming one is I first did my medical degree, and then I specialized as an ENT, and then I super specialized as a facial plastic surgeon. Now, in order to become a facial plastic surgeon specifically, in South Africa, it's not recognized as speciality, but in Europe and in the States, it is. And in order to become a facial plastic surgeon, you have to do a 2-year fellowship and write special exams, and then most of the surgeons overseas, about 70% of the facial plastic surgeons, are ENT trained. So all the plastic surgery, the reconstructive stuff, the cosmetic stuff, everything, the facelifts, the nose jobs, the fitting back the ears, cancers on the face, is generally done by facial plastic surgeons. Of that, 20% are normally plastic surgeons. The plastic surgeons generally are the body surgeons. It's very different in South Africa as it is overseas. And then we've got a small percentage of maxillofacial surgeons or ophthalmologists who do oculoplastic surgery, and some dermatologists who also do a lot of surgery in the head and the neck, and they also can sometimes qualify as facial plastic surgeons. Okay, so that's the first question. What is a facial plastic surgeon? So next question up here is, what is the difference between a rhinoplasty and a septoplasty? Or a septorhinoplasty. Okay, so a rhinoplasty is an operation that does two things. Firstly, it fixes the function of the nose, but secondly, it also fixes the shape of the nose. So a rhinoplasty is altering the shape and the function of the septoplasty. Is the septum is right here in the middle of the nose. You can see the columella here. The septum sits in the middle. Now, if the septum could possibly be bent, or the septum has like a spur sticking out that you have to surgically correct, that's called a septoplasty. Very often we do septorhinoplasties at the same time, meaning we are correcting the septum and the nose. So you can imagine if the septum's skewed, the nose is probably going to be skewed as well. So often when we're doing rhinoplasties, we're also doing septoplasties. Okay, so it's going good. Keep those questions coming. The next question is, how much is this surgery going to cost me? And will my medical aid pay? So, great question. If you had no medical aid whatsoever, and you had to have an operation to fix your nose, you're going to be paying. So that's the one side of the spectrum. And you're going to be paying for three things when you have an operation. You have to pay the hospital, who own the theatre. You have to pay the surgeon who does the operation. You have to pay the anaesthetist who makes sure you're asleep and you wake up after the operation. So you know that either you're going to be paying 100%. However, if you have a medical problem, and we can pick up that there are medical reasons for you to have the operation, and you have a good medical aid that covers everything, it might not cost you anything. So a ballpark figure in South Africa is it should be just under about 100,000 Rand if you have no insurance or no medical aid whatsoever, and you've got to pay everything yourself. Okay? That can come down to a few hundred Rand if you are fully insured. Most of the patients that I operate on have medical aid, and 99% of the patients that I operate on have a medical problem that I have to address as well. So generally, they're not paying very much for their operations. Okay, so next question. Let's see what's happening. How painful is the operation? So you've probably seen the photographs and the operations on TV or YouTube of how we cut open the nose and it's gory, a lot of blood and stuff like that. Surprisingly, the operation is not painful. We're not working on very painful things in terms of like breaking bones. They're very fine bones in the nose that we'd be breaking. And to me, what I love about seeing the patient the week afterwards is how they say to me, but Cameron, this thing wasn't sore. I was expecting to be in pain. I didn't even take any of my painkillers. So it's generally not a painful operation. There can be discomfort though. It's very important to understand the difference between pain and discomfort. Now, the discomfort is the fact that most of the patients have a silicone tube in the nose on either nostril, which comes out after a week, and they have a big plaster over the nose. So you can imagine having a plaster on your nose and a splint. It's uncomfortable. You may be a bit puffy, but you shouldn't be sore. Sometimes there's a bit of a loss of sensation in the front teeth and on the tip of the nose, but there should not be any pain. Okay, let's get to the next question. How long do I have to take off? Yeah, so that's a good question. It's a one-day procedure. So you would come in, have the operation, and go home the same day. Or if you're an out-of-town patient, you would go back to the hotel you're staying at. I would recommend you are off for a week. It depends on the kind of work you're doing. Some people don't really bother too much. They don't mind being seen in public. They don't mind going back to work when they've got a big plaster on the nose. A lot of the guys especially, they want to show off that they've had an operation. But the ladies generally would like to rather be completely healed before they go back. As a rule of thumb, I would say you're probably looking at between 1 and 2 weeks, depending on how badly you bruise and depending on how big the operation was that we did. Okay, let's crack on for another question. Dr. McIntosh, do you do an open or closed approach? Okay, so when we talk about an open approach, rhinoplasty, and a closed approach, it's two different ways of doing the operation. So an open approach is generally when we do a little cut at the bottom of the nose and we peel the nose back, we do all the operation and we put it back. That's known as an open rhinoplasty. The technical term for a closed one is actually an endonasal. So you don't see any cuts on the outside. And basically what you do is you're doing cuts inside on the different cartilages and repairing what you need to be done. So I would do about 95% of my operations with an open approach and some with a closed approach. Every single patient is individualized, so I'm not going to be just blanket doing what needs to be done. It's really important at this point that the patient and myself need to chat to each other and trust each other, knowing that I'm the right guy to do the type of operation that patient wants from me. So I am an open rhinoplasty doctor, specialist. I'm not opposed to endonasal work. If endonasal work needs to be done, I'm happy to do that as well. Okay, Dr. Mac, when can I start exercising again? Good question. How serious are you about your exercise and how intense is your exercise? And what kind of exercise do you do? So if you think about it, in the first week, you need to rest. You're going to have plugs in the nose. You're not going to be able to breathe through the nose very nicely. You're going to have had an operation from anything between 1 and 3 hours. The secondary rhinoplasties that we do can take up to 4 hours, maybe even 5 hours. Sometimes we can operate to 7 to 8 hours, but on average, I'm operating for about an hour and a half to 2 hours. So you're going to feel completely zonked out after all the anesthetics and you want to rest. You can get back into exercise the week after I've seen you and I've taken the plasters off, all the stitches out. You can start exercising. For the first 2 weeks, you need to be quite careful of not doing exercise that's going to put pressure up here. So if you're like a weightlifter and you're picking up weights and you're causing pressure, you can get bleeding in the nose, okay? If you're more of an endurance athlete, you're not going to be doing that kind of stuff. The contact sports, 6 weeks. If you're a rugby player or you're a boxer or a karate, something like that, and I've got to fix your nose, take 6 weeks off. People ask me, similar to that, the question is, Cameron, can I still carry on with my sports? look, if you're a boxer, no, you decide, get your nose sorted out after you finished your career. Because if we're spending 2 to 3 hours to fix it, and you go and you get smacked on the nose again, it's a lot of work that's gone into it, a lot of money. So, but generally, you're back to where you were before the operation within 2 weeks. Okay, let's get to another question. Dr. McIntosh, do I have to stay overnight? No, generally you do not have to stay overnight. We operate in the morning. The few patients that do stay overnight is if I am doing a list and you recover quite late, say by about 5 or 6 o'clock in the evening, the operation's finished and you're feeling quite groggy, I'd rather keep you overnight. And also the people that I have removed a rib from in the afternoon, we will do x-ray to make sure you don't have problems with the rib, but we would keep you overnight because it's be quite sore. The rib is the one area in rhinoplasty that people do complain about. This is quite interesting. What is SAWSA and what are these talks that you've been advertising on social media? Okay, so SAWSA stands for the Society of Rhinoplasty Surgeons of South Africa. And about 3 years ago, a couple of us who are very passionate about rhinoplasty started our society. And we have yearly meetings. It was 2 weeks ago, I was contemplating this whole lockdown thing, thinking, oh man, this is terrible. People are suffering, surgeons aren't working. So I put together a little schedule of live Zoom meetings, and I banged it out about an hour beforehand. And I had to pull in old Town as one of the facial plastic surgeons from Australia. He got up at 2 o'clock in the morning to lead our first meeting, and we had 28 guys from around the world who Skyped in on it, Zoomed in on the meeting. And then we had our second meeting. We're having every Tuesday and Thursday evening. Last week, Thursday, Goxel from Istanbul came on, and we went up to 90 participants. Then this Tuesday, we had, we moved to France, as it were. So we had Olivia on Tuesday, and we had 130. And then last night, we had Yves Saban, also from France, and we had 160. And this is 160 specialists from all over the world who are logging onto a Zoom meeting that the South African Rhinoplasty Society has started. So we've put together a schedule for the rest of this month and next month. So we're moving over to America next week, and we've got 2 big guns speaking. The one is Dr. Rorik from Dallas on Tuesday, and then none other than Paul Nassif from Botched. He is going to be speaking to us on Thursday. Now, obviously, this is closed only to rhinoplasty surgeons. It's not to the public, but it's been really cool to see how our society has grown. Okay, then I see there's another question that's come in. It says, Dr. Mac, when should I consider rhinoplasty? I think you should consider rhinoplasty anytime. So you need to go and look in the mirror and see. So remember 2 things here. It's firstly, what does my nose look like and how does my nose work? So if you're considering a rhinoplasty and you're worried about the money, maybe you should start thinking about, does my nose give me a problem? So questions to ask yourself is, how bad is your snoring? Does one nostril always have less air going in than the other? Because the septum might be skewed, something might be blocking one of the nostrils. So if you go like this and you breathe in and try the other one, if you can hear they sound differently, there might be one blocked. Do it a few times in the day to see if it's not the cycle that changes or if it's permanently blocked on the one side. Another thing that you could be suffering from is not being able to smell nicely. So there might be blockage in the nose because of that. You might have had been hit before, or had some kind of a trauma inside the nose. And then obviously on the cosmetic side, if you want to consider rhinoplasty. So I would say if people come and see me, I always ask them, what are the 3 things they don't like about the look of their nose, or the 3 things they would like changed? I love it if a patient comes in and they've got photographs of somebody whose nose they would like it to look like, and they can very specifically say to me something like, the that's very boxy on the tip, and they don't like how wide the nostrils are and the bump, and we can deal with that. Another thing in the function, so if you breathe in and the sides of your nose collapse like that, that's called your nasal valve that collapsed. So that's obviously a medical reason for us to do the operation, and we can address that and fix that. So to summarize the question, when should I consider rhinoplasty? Always consider it. See if you have a functional problem and see what your cosmetic concerns are. I see another question has come in. Would a rhinoplasty fix my permanently blocked nose? I use Iliadin almost always. So our relationship might come to an abrupt end. I don't like Iliadin. Do you understand what Iliadin is? Oxymetazoline. It's this very special chemical that you spray in the nose that opens up the nose. But if you use it for more than 5 days, it has the opposite effect and you get addicted to it. Stewie, how's it, man? Thanks for coming in. So to answer that question, will a rhinoplasty fix my permanently blocked nose if I use Iliadin? Number one, you need to get off Iliadin, off oxymetazoline. And then we can see, is there a reason for us to still try and unblock the nose? Because often, if you've been able to stop the Iliadin, the nose is open again. But we'll do things like cone beam CT scans, look in the nose and see what we can do. I see another question's come in here. Dr. McIntosh, can you have a second rhinoplasty or is it unsafe? So around about a third of the patients I operate on are secondary rhinoplasty patients. So secondary rhinoplasties do happen, and there's two main reasons why they happen. The first reason people often have a secondary rhinoplasty is that the outcomes aren't quite what they wanted. So it's a little bit of like a nip tuck just to improve. Maybe there's a slight bump that needs to be taken down, wasn't taken down enough, or the nostrils a bit wide. So it's like just a slight improvement. However, other group of rhinoplasties, secondary rhinoplasties, are kind of the botch patients where someone has done something that they shouldn't have done, or the patient might have hit their nose again. Various things can happen. I would really encourage you that seek out the rhinoplasty surgeon that belong to source. So remember the question I just answered about our Rhinoplasty Society. So if you go to the rhinoplasty.society.co.za website, you can see who the rhinoplasty surgeons are who are members of SORSA. And I'd really encourage you, find those guys. They're all around the country. These guys are guys who are committed to want to become better rhinoplasty surgeons. They go to courses. They are really good at what they're doing. So I'd encourage you, Middle East, to check that out. It should not be unsafe to have a secondary rhinoplasty. You'll have to be assessed quite carefully by somebody, because often with secondary rhinoplasties, we need cartilage or structure from elsewhere in the body. So we could take cartilage from the ear, we could take cartilage from a rib, we can take cartilage from other areas. So just make sure about that. Then I'm going to just answer, Dr. Mack, what are the risks involved with surgery? So you got to understand that there's two groups of risks. There's anesthetic risks and there are surgical risks. Now, I would say this to any patient who's going to theatre, even if they're going for a tonsillectomy, they're going for grommets, they're going for a rhinoplasty, you can die, okay? Theatre is dangerous. Things happen. Obviously, with somebody who is a rhinoplasty candidate, they're generally healthy people. This is elective surgery. It's very well controlled. We use anaesthetists. We look after, but that is life. So that's just for a mention to say. Okay, then in terms of the risks involved, the surgery itself is, I look at that as early risks and late risks. So the early risks are things that are when the patient wakes up, that their nose may be bleeding, that in that first week they might get an infection, that there can be a lot of bruising around the eyes. Those are not really risks more than slight complications, and we'll address those if we get them. Then the second group of the risks is what are the outcomes long term. So the long term things are things such as functionally the nose didn't improve as much as they'd like. So they say they still feel blocked inside the nostril. So we've got a really cool thing called a 4-phase rhinomanometer. It's a special machine that we use to test graphically the airflow and the pressure in each nostril individually. So we'll test the patient beforehand and test the patient afterwards. We also have questionnaires, so we can make sure that I'm pedantic about wanting to really have a good result, but you do get functionally not as good. And then cosmetically, some patients will come in and say, you could have taken that hump down a bit more. Maybe you took it down too much. So I would say about 5% of the patients that I operate on, I will take back to theatre because both of us aren't completely happy with what we want. Okay, I see there's another question that's coming. It says, "Hi doc, I was just wondering, can rhinoplasty be used to just make my nose look smaller and nicer? I also think I don't have much of a bridge on my nose." Oh, absolutely. Yeah, there's a lot of stuff that can get done on the nose. And if you have a look on further back on the Instagram, you'll see how it changes people's faces and profiles. But one of the things we need to remember, if you want to make your nose look smaller, is you can't just zoom in on the nose. You've got to look at the nose as part of the face. And often what people think is actually making a nose smaller, you need to make it bigger to fit the face. And so remember, in terms of the nose, the important things to remember is this is projection. So how far does my nose project out of my face? And then the rotation is, does my tip rotate up or does my tip rotate down? And you'll be amazed that for example, you think I've got quite a big hump now, but just lifting the tip up, the hump goes away. So this is what's so amazing about rhinoplasty, is this 3D surgery. You go and you do something on the one side and it changes everything completely. So I really, really love rhinoplasty because it's more like an art form in many ways. Okay, a question here from Zans. It says, would you consider snoring to be a symptom of a nasal defect then? 100%. So here's a little test if you want to try this. Try and close your mouth. Okay, so you're breathing through your nose and try and snore. It's a little bit difficult, but now I want you to breathe through your mouth and squash your nose and try and snore. So if you go like this, so you can imagine if someone comes for snoring, the first thing we need to check is start from the tip of the nose and look inside the nose and start seeing if the passage is blocked from the nose. I cannot think how many patients come to me afterwards and say, wow, my brother-in-law has had his nose fixed and he doesn't snore anymore. So yeah, I think absolutely if you are snoring, get to somebody who's a rhinoplasty surgeon, let them have a look and see. And there is a good chance that if the nose can get fixed, the snoring can improve. One of my mentors in Turkey, in Izmir, has always said that good rhinoplasty is good for your sex life. So, friends, I think